Well, let's return to the issue of veterans' mental health and suicide. We saw the Prime Minister a little earlier there today talking about, well, what support is available, what the government is doing to invest in that support, and raising awareness around the level of support that's there and connecting people to the appropriate level of support. The Veterans Affairs Minister, Darren Chester, joins me now from Melbourne. Minister, thanks for your time this afternoon.
Great to be with you, David.
Now, I guess the starting point here is the rate of suicide amongst the veterans community greater than the rate of suicide amongst the general community? How great a problem are we talking about here?
Well, David, this is obviously a very sad and complex issue right across our community. I mean, we've got in the order of 3,000 Australians taking their own lives each year, and I think the Prime Minister is right to make this a focus of this government. Now, we believe in the order of about 30 veterans per year take their own lives, and I'm sorry that I sound a bit vague on that, but we actually don't know every veteran in Australia. The only veterans we know in Australia are those who have registered with the Department of Veterans Affairs and receiving some level of support.
Let me just pull you up on that. So you don't know, the government doesn't know, how many veterans there are?
And that's right, David, and that's the reason why I believe we should have on the next census, a question in relation to have you ever served in the military, so we get a better handle on the exact number of veterans in our community. And the reason that's come about, David, is quite historical, in the sense that people may have served in the military, then left after a short period of time or even a long period of time, and then their details don't necessarily transfer in the past onto the Department of Veterans Affairs. Now, that doesn't happen anymore, I must hasten to say. Everyone who leaves now, we get their details, and so we're able to track them, but historically that hasn't been the case. So we don't necessarily know every veteran in Australia, which again, I think adds to the complexity of managing this issue of veterans.
Well, okay. Have you got any sort of assurance that the next census, at least, will ask that question so there can be some accuracy around this?
Well, that's why I wrote in the previous term of government, so when I was the Minister, obviously, before the election, to the Treasurer to seek that assurance, and it's been progressed as part of the normal census preparation. So that's a question to be addressed as the census is developed in the coming months. But what I would say in relation to your original question, it's important that Australians understand that our veterans do receive free mental health care for life. So regardless of whether they sustained an injury in the Defence Force or not, if they've served in the Defence Force, they receive free mental health care for life. And we simply encourage those and their family members, those veterans who are struggling with their mental health, to reach out for support. We've got to get better at reducing the stigma around mental health right across our community, but certainly within the ADF and in our veteran community. OK, but based on the numbers that you do know, coming back to that question, are you able to establish whether the rate of suicide is higher amongst the veteran community than it is the general population? Well, again, and I'm sorry, it sounds like I'm hedging my bets. It does depend on what the veteran does after they leave. So if a veteran leaves full-time military service and then goes on to reserve service, we know their mental health wellness is better than the background population of all Australians. Where we have younger members, particularly younger male members, who leave the Defence Force and then don't stay involved with Defence, either in reserves or any other way, we do know they have worse mental health outcomes. So again, that becomes a trigger point for us in DVA and within the transition team to provide more support for them.
I was looking at the Australian Institute of Health and Welfare's most recent data on this, which goes, I think, from 2001 to 2016, so a 15-year period. It shows the rate of suicide is markedly lower amongst serving Defence Force members and even Defence reservists, something like, well, nearly 50% lower, but veterans, so once they've left Defence and cut their ties even as reservists, that's when the rate of suicide is somewhat higher, about 18% higher than the general community.
Yeah, the rate of mental health conditions, not necessarily resulting in suicide, but mental health conditions. And it's I guess, David, our real challenge is within DVA, yes, we do have free mental health care available. Yes, we do provide in the order of $11 billion of taxpayers' money to support veterans and their families. So there's money there. It's not capped. It's available. But then we've got to reach down into our communities and make sure that the veterans are well supported when they go back to their communities, when they leave the Australian Defence Force. I mean, while they're serving, they've got access to that free medical care. They've got meals and accommodation and a whole range of things provided which support them in their employment, in their very unique employment. But then our challenge is making sure that it's not just about the department or the government, that when they actually go back to community, they're well supported in those communities as well. So it is a very sad and complex area of public policy, I guess, and one where I think we're right to try and focus more on. And that number I said at the outset of 3,000 Australians taking their own lives every year saddens me greatly. I think it's an issue of somewhat of national shame that we haven't been able to reduce our rates of suicide. And I think it's important that we have these conversations in a very responsible way and make sure that we destigmatise mental health issues.
Well, as you point out, not everyone gets free mental health provision, but veterans do. Is the problem the difficulty around accessing that? We've seen, certainly in the Telegraph, the mother of one Afghan veteran say it was very complicated filling out forms and so on. Do you acknowledge there are problems there in accessing that support?
I think historically there have been problems. I mean, we've just spent in the last 3 years $500 million on transforming the Department of Veterans Affairs to try and make their claims process simpler, because we recognise that can be a source of stress. We've had the Productivity Commission, which will report back to me or report back to government in the next couple of weeks, having a root and branch look at DVA about how do we make sure this organisation is right for the next 100 years. So that will report to government very soon. We've seen changes around providing payments to every veteran with a mental health issue who makes a claim, to make sure we tide them over while that claim's being processed. So the other question I guess you did ask around access, right across Australia we have some issues around access to medical specialists, not just involving veterans. We see a concentration of our medical specialists in our metropolitan areas, but a lot of our veterans live in those regional towns. We need to make sure there's access to those services in a regional setting, just as we have that challenge, I guess, for all regional Australians.
Well, indeed, in the general population as well. Look, the Prime Minister has asked for an urgent briefing from your department. What are they going to tell him that he doesn't already know?
I've had conversations with the Prime Minister in the past around veterans' mental health, and it's part of the reason why I think he encouraged me to continue in the role was to continue that continuity, if you like, of the reforms we're progressing. I've organised in the next couple of weeks for the leading health professionals in veterans' mental health to all come together and meet with me and my department as we get our focus around what else can we be doing which is practical, which delivers on-the-ground benefits. We don't need necessarily more academic reports. We need more discussion around what can we do that makes a difference on the ground. And one simple thing I've spoken to you before about, I've encouraged the DVA, my department, to now provide financial assistance for the purchase of assistance dogs, because veterans have come to me over the last 12 months and said, see that dog there? That dog has helped to save my life. That dog has helped me with my stress, my anxiety. It's got me out in public. Now, previously, we didn't fund those dogs. Now, we're in a position that on the background of, with this medical specialist advice to a veteran saying an assistance dog will help them, we're going to work with them and meet the cost of purchasing that dog. So that's a small but a practical example of things we can do to work with our veteran community to reduce mental health issues in that community.
So if small practical measures like that, assistance dogs and so on, are the key now, and you mentioned there's no need for further academic inquiries, what do you say to those who want a royal commission?
I say to them, I understand your frustration and why you're making that a claim or calling for it, but I don't want to spend $100 odd million paying lawyers when that money could be spent on medical assistance, on mental health specialists, providing more on-the-ground support for our veterans. I don't see the point in having a lawyer inquiry into DVA when we've already got the Productivity Commission reporting back in a couple of weeks. I've had probably the best part of 20 round tables with veterans, ex-service organisations this year where we've gone through different issues. I've got the medical specialists, the mental health specialists meeting with me in a couple of weeks' time. So that work's already ongoing. What we do need to do is make sure we're getting those services out on the ground to people when they need it. We've got to make sure we're supporting the veterans and their families after they leave the ADF, but also while they're in the ADF. And I've had conversations as recently as this afternoon with the Chief of the Defence Force, last week with the Chief of Army, Chief of Air Force, on other measures we can do to make sure we're providing for the mental well-being of serving members during that time in the military. So I want to stress though, David, service in the ADF, service in the military is generally a very positive experience for most people. They learn great skills, leadership, teamwork. They're very patriotic people who take those skills with them into their civilian life. Certainly good for our community to have those people back in the community doing wonderful things. And it's important for our nation to have that national security focus. So service in the ADF is generally a very positive experience, but we have to make sure if people are injured physically or mentally that they're well supported as they transition into civilian life.
Now, Darren Chester, I've seen you addressing veterans, I've seen you addressing serving troops as well, and most recently that was last year when we were in Iraq and Afghanistan. You, of course, met with a lot of the personnel serving there in Iraq. I want to ask you about yesterday's announcement from New Zealand Prime Minister Jacinda Ardern has said over the next 12 months they're going to be withdrawing all of their troops from Iraq. It's a joint task force operation in training the Iraqi trainers over there. What do you think of that announcement, and do you expect Australia will eventually follow suit?
Well, what I'd say first of all, David, is the work that the Australian New Zealanders have done in partnership in Iraq has been quite exceptional. We're part of that global coalition in helping to train the Iraqi security forces to be in a position to deal with their own situations in their own country. So quite remarkable work by the Anzacs yet again. Now, in terms of our future involvement, that's really a question of ongoing review by the government. It's something I think the Defence Minister may have already commented on today. It's something the National Security Committee would look at the right time. But we're very proud of the work that our troops are doing in Iraq to train the Iraqi security forces, and we're making sure they're well supported in that work.
Veterans Affairs Minister Darren Chester, thanks for joining us this afternoon.
All the best, David, and thank you so much for your interest. And I just encourage any of our veterans who may be feeling the need to contact Open Arms, our Veterans Counselling Service, on 1800 011 046 if you do need that support.
Okay, thank you very much.